This week's Medicine of the Week is a class of drugs called Prokinetics. Prokinetics enhance gastrointestinal motility by increasing the frequency or strength of contractions without disrupting their rhythm. In this video, we are going to talk about the most commonly used prokinetics, which are the dopamine D2 receptor antagonists, Metoclopramide and Itopride. The mechanism of action is based on blocking the dopamine D2 receptors primarily in the gastrointestinal tract. This leads to increased release of acetylcholine from enteric neurons, enhancing gastric motility and emptying and increasing lower esophageal sphincter pressure. Metoclopramide also inhibits the 5-hydroxytryptamine 3 receptors in the chemoreceptor trigger zone of the brain and thereby having also antiemetic properties. On the other hand, Itopride inhibits acetylcholinesterase and thereby increasing acetylcholine levels and further promoting gastric motility. The indications depend on particular drug. Metoclopramide is used to treat and prevent nausea and vomiting, including chemotherapy-induced nausea and vomiting, radiation-induced nausea and vomiting, and also nausea and vomiting associated with migraine or surgery. On the other hand, Itopride is used to treat conditions like functional dyspepsia, gastroesophageal reflux disease, or gastroparesis. Let's talk about pharmacokinetics. There are interesting differences between the two agents also in this area. Metoclopramide is rapidly absorbed after oral administration, it is widely distributed in body tissues, and it crosses the blood-brain barrier. Metoclopramide is metabolized in the liver via cytochrome P450 enzymes and is excreted mainly via the kidneys. Elimination half-life ranges from 5 to 6 hours. It can be administered orally, intravenously, and in some countries also as a suppository. Itopride, on the contrary, has minimal to none ability to cross the blood-brain barrier. It is metabolized in the liver via flavin-containing monooxygenase and it is available only in peroral formulations. It is excreted also via the kidneys with approximately the same half-life as metoclopramide, that means 6 hours. Let's look at the side effects. Thanks to the ability of metoclopramide to cross the blood-brain barrier and to block dopamine D2 receptors in the brain, extrapyramidal symptoms like dystonia, akathisia, or tardive dyskinesia may occur. Therefore, metoclopramide is contraindicated in patients with Parkinson's disease. Another typical side effects are hyperprolactinemia, gynecomastia, fatigue, and anxiety. Metoclopramide can negatively affect the heart rhythm, primarily by prolonging the QT interval. This risk is elevated in patients with pre-existing cardiac conditions, electrolyte imbalances, or those taking other QT prolonging medications. In case of Itopride, there is no increased risk of extrapyramidal side effects, as it has minimal ability to cross the blood-brain barrier. Typical side effects include gastrointestinal problems, hypersalivation, or headache. Now let's talk about potential drug interactions. Due to the prokinetic effects, metoclopramide and Itopride may influence the absorption of orally administered drugs. Caution is needed in case of drugs with narrow therapeutic index or extended-release formulations. Metoclopramide has several other interactions. For example, levodopa and dopaminergic agents antagonize the effects of metoclopramide. Concurrent use with serotonergic drugs increases the risk of serotonin syndrome, and co-administration with neuroleptics such as haloperidol increases the risk of extrapyramidal symptoms. Furthermore, combination with QT prolonging drugs is not recommended too. Focusing on Itopride, it has generally fewer CNS-related interactions due to minimal CNS penetration. Most common interactions include combinations with anticholinergic drugs, which act antagonistically. In summary, both metoclopramide and Itopride are effective prokinetics with distinct pharmacological profiles and clinical uses. While metoclopramide is more versatile, Itopride offers a safer alternative with fewer CNS-related adverse effects. Thank you for watching. For more information, consult your medical textbooks or reliable sources.